Nick the nurse. Today we're going to be talking about some of the nonverbal cues in order for you to develop a better treatment plan, a better care plan in order to help your patient reach their full potential. For example, if you have a patient who is walking around the room, they're pacing back and forth to and from, and they're looking down, or they're sighing like that, what do you think might be going on with that patient? You think they might be ecstatic? You think they might be happy? You think they might be elated? No, probably not. In this particular case, what might be going on with your patient is they might be what? Anxious. So it's important to kind of look at some of the nonverbal cues that come from your patient. Most patients aren't going to come up to you and say, oh nurse, you know what? I'm really anxious right now. Can you help me? Granted, some people are pretty in touch and intuitive and they know what's going on in their bodies, but for patients who have gone through a lot of stress on their bodies and on their psyche through mental health disorders, a lot of times it's the nurse's duty to pick up on these nonverbal cues. For example, if you had a patient who was darting around the room looking like this, and they weren't saying anything to you, and they were just kind of going like this and maybe mumbling, right? That might indicate what? It could indicate that the patient is what? Hallucinating. The patient might be seeing something that's actually not there or hearing something that's not there, and they might be responding to the environment around them. And here we're focusing on seeing what's actually going on with the patient in order to help perform an assessment which can help aid eventually in a nursing diagnosis and a medical diagnosis if one isn't already made. Now this is also important because it can help see if in a patient who's already been diagnosed with anxiety or hallucinations or depression or what have you, to see if they're meeting the therapeutic goals that have been set by the nurse in his or her care plan. So it's really important for you as a nurse, not only in nursing school and not only on the NCLEX, but also in your professional practice, to understand to look for nonverbal cues in order to assess your patients and help them realize their full potential. I'm Nick the nurse. I would like to thank you for watching our video, and we'll see you next time.